My name is Dr. Joseph McGurk. I am the Division Director of Hematologic Malignancies and Cell Therapy at University of Kansas Hospital. That's fancy terminology for taking care of patients with blood-borne cancers and providing them with stem cell transplants and other chemotherapeutics. What I'd like to say is that it's an extraordinarily promising time in cancer medicine. We're seeing breakthroughs on an everyday basis practically, and the understanding of cancer biology is unfolding in an extraordinarily eloquent way, and that's allowing for us to target much more specifically cancer cells and bring about a better effectiveness of our cancer regimens, at the same time increasingly minimizing toxicities to our patients and better successes. We're in the middle of a revolution right now. The challenges that we face beyond the science of identifying new drugs, new types of therapy for our patients is that many of those new therapies are extraordinarily costly to develop, and that in part correlates with extraordinarily high cost to the healthcare system, and very importantly to our individual patients. And so we're all greatly concerned about this issue nationally, about the rapidly escalating cost of these new drugs for our patients, our ability to sustain that as a society, and very importantly its potential impact, adverse impact on our patients and their families, and taking food off the table so that they can afford these drugs or being able to pay the rent.
I'm Richard Gilroy. I'm a professor of medicine at the University of Kansas, and I work in liver disease. What we have currently now is a significant change in how we manage patients with liver disease. We have tablets that are at least 95% effective across the board and can cure hepatitis C as compared to the previous therapies that were around 40 to 50%. With that, we also have a marked reduction in side effects with the tablets as compared to the prior therapy. However, we have a significant increase in the costs. These costs have changed with various factors, including market pressures, the corporate environment, and most importantly, obviously, the efficacy and how well the drugs work. And the people who are dictating the costs, in general, is a relationship between the drug companies and the payers, which would be Blue Cross Blue Shield and the insurance companies, or the Veterans Affairs companies. In the future, there will be more medications and the prices will drop. Maybe not today. And finally and importantly, I think when we look at the therapies in the treatment of hepatitis C, that's critically important as it prevents progression of liver disease, cirrhosis, liver cancer, and in my case, me having to manage you for a liver transplant. Moving forward, I would like to see the costs of these drugs adjudicated by larger national bodies, and involvement there is critically important.